So in this video, we're going to talk about how to manipulate the cuboid. We've done a few different videos of mobilizing it, but sometimes I just like to manip it. It's a little bit faster. Typically, people have been taught to do a cuboid whip manip. I don't like to whip because when you whip it, you wind up stressing ligamentous structures, specifically ATFL, and I just try to leave those alone if I can. So I use more of an inertial type of movement. But the reason that you would need to do this is you have someone's cuboid that's stuck a little bit down and in. And so sometimes this can happen with lateral ankle sprains. Someone has an inversion ankle sprain, their peroneals come down, inserts here, that contracts, pulls the cuboid back and displaces it. And now they'll tell you they feel like they're walking on a rock in their shoe because they're walking on that bone that's stuck down. And so if you can get on the medial aspect of it, and essentially push it forward with momentum, then you can put it back into place. You're not going to get a cavitation with this all the time. You might, depends on how stuck that cuboid is. So I'm going to do this on Juliana. So I'm going to have her stand and face away from me. And so, as I mentioned, I don't grab and whip this way. I'm going to take her foot and I'm going to lock out the cuboid, and then I'm going to move quickly forward to thrust it back into place. So can I see one of your feet? Perfect. And so I'm going to find her cuboid. So I get at the base of the fifth metatarsal, come up, and that's where the cuboid lives. Medial aspect is here. And so typically, as the person is dorsiflexing, that's where I'm going to find the biggest restriction in that cuboid, where it's going to drop into my finger. She doesn't have a stiff cuboid, but I would lock out with a combination of dorsiflexion. You can do inversion, eversion to where you feel like they're the most stuck. And then from here, it's a quick thrust. And so you'll notice it's an inertial manip. So my momentum happens and her foot lags behind, and that's what thrusts it back into place as her knee comes forward. So again, get them nice and relaxed, thrust. Okay? And so that is one way to manipulate the cuboid.